the camera, this movie we making is action packed. Safe sex is great sex.
Hi everyone, this is the Real Deal Sex Ed, and today I wanted to talk about the sexually transmitted infection known as gonorrhea. Now, gonorrhea is one of the more common infections. It's treated using antibiotics. This one I wanted to touch on first because I've been hearing a lot of things within the last couple of years, and there are a few strands of gonorrhea that are becoming resistant to the actual antibiotics that are used to treat them, which means at some point they're going to have to probably come up with some new form of treatment, which is pretty scary to say the least. So I'm just going to go over some general information and, of course, some ways to be safe and things to look for. So as with all STIs, the use of condoms and having that open conversation with your partner, make sure you're being honest. It's best if you have a long-term monogamous relationship, but even if not, you should be getting tested, whether that is with or without your partner. I would try my best to get tested with your partner so you can both know your status at all times and do it on a continuous basis for as long as you are actively engaging in sex. So gonorrhea can be passed through unprotected vaginal, anal, oral sex. You can get it in the throat, in the anus, and the vagina and penis. So also, if you have gonorrhea or you find out that you have gonorrhea while you're pregnant, you are at risk of passing the infection on to your child during childbirth, which has caused a lot of health issues for the baby. So that should always be treated as soon as possible to reduce the risk during pregnancy. And, you know, even if you're not pregnant, you don't want to house any infections inside of your body for a long period of time because that can cause a lot of other health issues. One of the top issues would be infertility at some point. So a lot of times for both men and women, signs and symptoms of gonorrhea are sometimes slim to none. Most times you don't have any symptoms at all, or if you do, they're flu-like symptoms. So you think you have some kind of harsh cold or something like that, something that'll go away with some over-the-counter drugs. And a lot of times the symptoms do cease. But for things to look for, in the case that you are one of the ones who do have symptoms, it will be a burning sensation during urination for both men and women, white, yellow, or green discharge from the penis, or painful or swollen testicles. For women, women, we have different vaginal discharges during natural states anyway, but an increased vaginal discharge or a foul smelling odor. I mean, all vaginas have a unique smell to them, but if there's anything like foul or fishy outside of like a slight yeast infection or something like that, you should be checking into that. Or vaginal bleeding between periods, which should also be something that you might not recognize because a lot of women do spot in between their cycles. So for the anal infections, you should look for discharge from the anus, of course, anal itching, soreness, bleeding, and painful bowel movements. So these are signs and symptoms to look for. Again, I will reiterate, getting tested regularly, using protection, which would be condoms, dental dams, things like that when you're participating in sex, and having that open conversation with your partner and also with your healthcare provider, you know, letting them know what's going on, you know, so them giving you the proper time frames to get tested in between time. And if you do have the infection, of course, they'll be able to give you the antibiotics needed for your treatment. So, again, my email, therealdealsexed@gmail.com, for any comments, questions, any topics you want me to discuss. Feel free to email me with those.